Hello, everyone. My name is Diane Baumkamp. I'm a licensed dental hygienist. I've been practicing clinically for 46 years, and I work in a periodontal office, which is a gum specialty practice in Creve Coeur, and have been there quite a long time as well. And I'm here today to talk to you about oral health and your body. And this is hopefully going to be something that will be of interest to you. Obviously, you're here, but I think you'll learn a lot about the connection between oral health and total health. And first of all, let's start talking about why teeth are even important. And first of all, you get a very nice shape to your face. If you don't have teeth, your jaw sort of sinks in. It helps you with chewing your food, and it starts the digestive process and your nutritional process. People who do not have teeth have difficulty eating without good nutrition. You know what that does to your health. In addition, oral health or your teeth also help you with speech. When you're trying to say the word the tongue goes up against the teeth and helps you formulate your words, which is very important. That's why when we have, say, for Christmas you want your teeth, it's because it helps you speak better, if nothing else. Also, teeth help you with your self-esteem. You have a lot more confidence. You are able to socialize more easily. I have a good friend of mine who's lost several teeth, and she's always like this with her hand in front of her mouth because she's not happy with the way she looks right now. So it does help you with socialization and being able to participate with activities. And by the way, I'm here at the podium because they're recording me, so I'm usually kind of walking around, but I'm trying to be good and stay in one spot, okay? And in addition, it helps promote overall good health and comfort for anyone. So the teeth are very important just in that way. But you're going to also find out that oral health will affect your total health. It's not just about teeth. The teeth are not separate from our bodies, but they're part of our bodies. The teeth are part of the same bloodstream as everything else in your body. So it's very important to kind of remember that. We sometimes, and even with you all being insurance, sometimes you're thinking, well, dental's different from the rest of you, the way the insurance goes, but we know in reality it is not. And also, the mouth is the gateway to the body because since the body can affect your mouth can also affect the body, and I'll be talking a little bit about that today. And one of the things I want to really stress is that we all have bacteria in our mouth. We have good bacteria and we have bad bacteria. And the bad bacteria can harm the mouth and harm the gums and make them prone to infection. And what we're going to be talking a lot about today is inflammation. And inflammation is a reaction to something being in our body that is not supposed to be there. It's something foreign. For instance, if you have a splinter in your hand, it's all red around the splinter. Your body's telling you something's there that shouldn't be there, and it doesn't go away until that foreign body is removed. So you want to think about that in terms of your mouth. If you have bacteria in your mouth that are bad, and they continue to stay there, you're going to see inflammation in your mouth, and I'm going to be a little more detailed about that as we go through this presentation today. Also, this inflammation, again, is just a sign for you to kind of pay attention. There's something going on because sometimes, I have people say, well, my gums bleed, but they've been doing that forever. Like, well, if you brush your hair and your head would bleed, you probably would think something was wrong. Bleeding is not supposed to happen anywhere unless, you cut your finger, it'll bleed then. This is the earliest form of gum disease is called gingivitis. Gingiva is the dental term for the gums. Itis means there's inflammation of the gums. So gingivitis means and it's found in adults and in children. We see it a lot in children. And if you have kids and you have any bleeding gums on children, that's probably gingivitis that you're looking at on your children's teeth. It is reversible if it's treated early with good home care and with professional cleanings and professional work. But it's something that you do not want to leave alone because it will progress. And the major cause of gum problems is bacteria in the mouth that should not be there. We call it plaque. It's kind of a sticky substance that gets on the teeth. It's very sticky and when you're trying to remove it, you think about like when you're removing grease from a pot, you have to scrub a little, and then you rinse a little more. You scrub a little, you rinse a little more. It's kind of the same thing with plaque on your teeth. One touch of the floss is not going to remove the plaque. It has to be scraped layer by layer through the bacteria to actually remove the plaque. I have that happen all the time when I'm working with patients. Well, I'm flossing. How come I'm still having problems? You're not maybe getting deep enough. You're not getting through all those layers of bacteria to remove them. And then we kind of go through that and with a little education, and they're like, oh, yeah, I haven't done it that way. So that's one thing you want to think about. The plaque can cause the gum to become inflamed, and then an infection, again, will lead to a further disease. If you look at the slide on the left with the red dye on it, it's kind of the pink dye, that's what we call a disclosing solution, and that's just disclosing where the plaque is, because a lot of times you cannot see it. So in my office, I do this with every patient so they can see where their plaque is. You can see that it goes underneath the gum. It's usually right around that gum line, and that gum is swollen around it. The gum is swollen because the inflammation process is at work there, trying to say, there's something in there, guys, get it out so I can heal. You know, your body's telling you something. If you look at the right slide, you can actually see there's a lot of plaque on it. You can see it, and even on that front tooth, you can see that decay has occurred around the area where the plaque has been sitting for a long period of time, as well as the gums being swollen and puffy, and they probably bleed by looking at them. So plaque is the major cause. It's not because you got it from your mother, okay, or your dad or anybody else. And gum disease being prevalent in children, we have about 35% of our 3-year-olds will have some form of this gingivitis, and anywhere from 65 to 97% of our older children and adolescents have gingivitis. And in some cases, about 1 out of 10 children will have a very aggressive form of gum disease, and they will have bone loss at a very early age. We're not sure why they have that. It's kind of like, and people will say to me, well, how come I have this? And my husband never flosses, but I would try to work on my teeth. Think about it this way. Some people are allergic to things and others aren't. Some people are more sensitive to one thing than others. Why? We don't know. God made us that way. And so some things we just have to accept and say, well, I know I'm prone to this problem, so I'm going to have to work harder to make that problem go away. So kind of consider that. You can also see on that slide way on the right side there's been some recession of gum. Sometimes the teeth come in that way because there's not a lot of thick gum around the tissue. And this is a child's tooth. You can see those little bumps on the top called mamelons. That you see on children's teeth a lot because they haven't been worn down yet from chewing. But that gum there, if that stays like that, that's going to be a problem down the road for that child. So, these types of things are things that we would look for when we're looking at our patients. Now, when the gingivitis starts getting to a more severe stage, we call it periodontal disease. Perio means around, dontal means tooth. So the disease is around the tooth. And what happens is not only do we have bacteria right around the gum line, but it's hit the gum. You can see the redness on the gum on the left side. And on the right side, you'll see the one little area where the, right, I don't know if you can see it in there, the bone has started to melt away. The bone should be at a high level, and here it is not at a high level because it's actually affected the bone. That bone on periodontal disease will not grow back. So once you lose that bone is gone. The good thing about it, though, you can at least get to a healthy state many times where you don't lose more bone. And that's what I have to do many times when I'm working on patients. But think about it, about 1/2 of our adult population of 30 years of age or older will have a mild, moderate, or severe type of periodontal disease, and 64% over 60 will have it. That's a lot of people with gum disease. So it's really important to make sure that you all and your family are getting routine dental visits, because this will only get worse. It does not get better by itself, okay? And you can see that plaque in between the teeth and the gum line. Those are important zones for this problem. And I know these are a little gross, but these you can see here, people have lost bone in between the teeth. They've got what we call calculus, which is hardened plaque on the teeth. The teeth are longer, there's spaces between them. And on this one, the normal bone would be up here, right up in here. Look at where that bone is. All that blank spot means all lost bone. So if a person doesn't have enough bone, the teeth become loose and they will not hold up. It'd be like losing a basement of your house. If you lose that basement, what happens to the house? It's going to fall in. And that's what happens in terms of your teeth as well. So that's a big issue. And then kind of on the right side, that very right slide over here, you can see the puffy gums, but you can also see the teeth are kind of banging on each other because there's a bad bite. Some of these other things are contributing factors. So, you know, that's why orthodontics isn't just because we want to have straight teeth. We also want to have teeth that are hitting properly so that there's good balance in the mouth and the teeth aren't banged and banged and banged, and then you lose them from trauma as well, okay? So that makes sense a little bit, okay. Now, there's several symptoms of gum disease. One, you'd have your red swollen gums. They may bleed, and smokers won't bleed as much, but smoking is one of the highest risk factors for periodontal disease. So if you are a smoker, it really it would not surprise me if you had gum problems. Persistent bad breath and taste problems would be symptoms. The teeth, again, would look longer, as you saw on that slide, how long those teeth looked, because that bone in between the teeth had melted away. And sometimes because the teeth are longer, the root surface is exposed, so that part of the tooth becomes more sensitive to hot and cold. So, and certain foods like sweets might also affect the sensitivity level. Also, in many cases, you'll see little gum boils or little pus balls above the tooth. That's a sign of a problem. If you see that, you need to see a dentist because it will not go away. There's probably either a nerve problem or a regular gum problem because it's showing itself on the gum. The infection has nowhere to go, so it comes out on the gum, and it's an abscess. So if an abscess goes too long, a tooth can be lost. Okay, and I mentioned that teeth get loose. There's more spacing and shifting between them. When you bite down, the bite might be the same anymore. If you have partial dentures, they may not fit well anymore because of the rotation and the movement of the teeth from not having enough bone. And what are some of these risk factors? Who's going to be more prone to periodontal disease? Those who have poor oral hygiene, those who have a lack of dental care and visits, those who have a low host resistance. And what I mean by that is I could have a bunch of bacteria in my mouth and you could have the same amount in your mouth. I may have the gum problem, you may not. It goes kind of with that same thing I said before. Why are some people allergic to something and somebody's not? We don't know, but we do know that if it's a problem for you, you have to work harder than the other guy, okay? Because some people cannot handle a certain bacterial load in their mouth. And we do have about 30% of the people are more genetically susceptible, but it doesn't mean because that mom had gum disease that you will have to have it. But it means you might be susceptible to it, but it doesn't mean that you have to have the same problems that mom had. Stress, like with anything else, can make the periodontal disease worse. It can also be episodic. Sometimes it might be good, sometimes it might not be good. If you have high stress levels, the periodontal disease might become more severe. Grinding and clenching of the teeth will be something that harms them. Anatomical abnormalities, for instance, if the tooth is is rotated or it's harder to clean, that tooth is going to be more susceptible. And also certain medications, I'm going to get into that in a minute, but certain medications will make the gums worse than others. And female hormones and pregnancy can affect the gums for women. Certain other diseases like diabetes and poor glycemic control is a big issue that we will talk about as well. So diabetes, I was telling one of our people here today that I see about 8 patients a day and at least 2 to 3 have diabetes because there's a strong connection between diabetes and gum disease. Smoking, as I mentioned, #1 risk factor, and poor nutrition and obesity. Okay. Oh, let me just go back just for a second on this one slide. To see this little probey thing? This is what we call a periodontal probe, and this probe goes into the gum, and you should be having your dentist measure your gums at least once a year, if not more often. This will help determine how much bone loss you've had, that plus x-rays. So a lot of people, I don't like x-rays. We need x-rays to see the bone levels. We can't see them. We sometimes need to see the root tips to see if you have an abscess. So there are reasons we don't want to take them every day, but you do want to take them on a periodic basis. So remember I was talking before again about this whole thing about inflammation. So this whole gum disease thing creates an inflammation response, and then the gingivitis, remember it's still reversible at that point when you have beginning gum disease. Then you get periodontitis, and when you get that and it's not treated, it can also hurt the rest of your body, and we'll be kind of talking a little bit about that more. But first, I also want to talk about dental decay. So normally here, the white part of the tooth up there is the enamel. Underneath it is the dentin, and that pink area in there is the pulp. Some people say, gee, I need a root canal. Well, that pulp area is where you get the root canal. The nerve is removed from the tooth if it gets so infected that the nerve dies, and you got to get that infection out or can create an abscess situation. But I want to let people know that in order to have tooth decay, you have to have 4 things present. First, you need a tooth. You need one that you have to have acid-producing bugs. And one of the major bugs that causes tooth decay is called Streptococcus mutans. And there's some what we call lactobacillus. But those are the main ones that help progress with tooth decay. And they have to have some fermentable carbohydrates. And the carbohydrates don't have to just be sugars and sweets that you eat. It can also be soda, it can be energy drinks and other things like that that have a high acidity level in them. And you need to have the repeated exposure to them. If you have something once in a while, it's probably not going to hurt you. But if you do it all the time, it probably is going to hurt you. Another thing that people don't know is tooth decay is infectious. It's transmissible, and it is preventable. And if you are a mother and you have a child and you put your baby to bed with a bottle, that lactic acid in the milk will probably cause tooth decay on the child. If you have tooth decay in your own mouth and you're sharing utensils and you're drinking out of the same cup as your child, you can transmit your bacteria to your child and make that your child more susceptible to tooth decay. So you really don't want to share those things. You don't want siblings to share the same bottle. It's just not a really good idea for doing that, because those tooth decay germs can be passed on through saliva. So you want to be really careful with that. I will say that teeth like fluoride. I'm not going to talk too much about fluoride, but fluoridation now is in the water has now 70 years we've been doing this. It's helped reduce tooth decay. When communities have taken it out of the water, tooth decay levels have gone up. So I love fluoride. I just had to throw that in there, okay? Can adults get tooth decay? Yes, they can. Particularly, they're going to be more prone for in between the teeth and at the gum line. As those teeth recede just a little bit, the gums recede a little bit, they are more prone to having that. You can see kind of on this particular, wrong one, this little slide here where the root surfaces are showing. Can't get the laser going, but anyway, you can see that where the root demarcation line is, those areas are way more susceptible to tooth decay than the enamel is. And dry mouth is one of the major causes of problems, particularly in adults, because we don't have enough saliva to flush out the bacteria. And certain medications are more prevalent in older people. Chemotherapy will also dry the mouth out. Certain radiation treatments to the head and neck will do that, and increase sugar consumption as well. Sucking on the hard candies all the time, or using those drinks that we talked about, soda and such. And the inability to clean the teeth, particularly if someone has arthritis or they can't use the hands as well anymore, or if you have a stroke, those things make it more difficult as we age to clean the teeth. So adults certainly can get tooth decay, and adults should also have fluoride. That's really important. So let's talk about the link between systemic diseases and oral health, and how many diseases first will appear in the mouth. And these are just some slides. I'm not trying to gross you out with the slides, but I want you to at least see, if I'm looking at them as a dental professional, I'm going to look at the tongue. I'm going to look in there and see that mouth is really dry. It looks like a desert on that left one, because the mouth is so dry that person doesn't have any spit. And spit is really important, okay, to keep the mouth lubricated and to be able to chew the food right and to not get tooth decay. And in the middle, for instance, that patient has a tuberculosis lesion. We don't see that much anymore, but you can see it once in a while. It might be the way you diagnose the disease, by seeing it in the mouth first. Over there we have Kaposi's sarcoma. For the AIDS patient, we see that a lot. When we see something in that, we think, something's going on here that's not right. So sometimes we can spot things in the mouth that we wouldn't otherwise know about. So it's important that you have a good head and neck exam when you're in there. Also, look at this child. this child is all swollen from a tooth abscess. That's not his tooth abscess there, but you can just see the fever in his face almost. But that's what an abscess might look like. It looks like a big pimple, and it usually has like yellow pus coming out of it if you touched it. So if you see something that in your mouth or in your children's mouth, go to the dentist right away so that doesn't become even worse. And it might be from a nerve because that person's had a lot of dental work done. He's got some crowns. He's got some fillings along the edge of the gum. Who knows, why that has happened, but we know that something's going on there. We also know now that so many people have cardiovascular disease. It's one of the biggest killers here in the United States. But we now think that there is a link between heart disease and problems in the mouth. So recent studies have shown a strong association between gum disease and cardiovascular disease. We're talking about 91% of heart patients may have periodontal disease. And there is evidence that they may have 3 times are more likely to develop heart problems than those without gum problems. So there's kind of a two-way street. There's not a total cause and effect yet, but there's some really strong links, and a lot of research is being done on this. But think about it, we have similar risks for both diseases. Smoking is a high risk. Now they're finding that obesity is a high risk for periodontal disease as well as for heart disease. Unhealthy diet, stress, and poor diabetes management. So all of those things are linked for both of these diseases. We also know that the bacteria in the infected gums break down the surrounding tissue and create that inflammatory response, that big inflammation thing again, and that bacteria enters into the bloodstream and can carry it down into the circulatory system. And we think that it may attach the fatty plaques in the arteries and helping to form clots that can lead to heart attacks. That's what they think the mechanism is. They're not quite sure, but they think that's what happens. We also know that it can travel into the heart valve and into a tissue, muscle tissue, and cause what we call infectious endocarditis. Many years ago, we would pre-medicate patients for heart murmurs and certain types of things. We don't do that anymore, but if you've had infectious endocarditis, if you come to the dentist, you would have to be pre-medicated with an antibiotic before we treat you, just in case you had a lot of bacteria in your mouth. We wouldn't want it to get back into the heart again and further harm the heart. So some high-risk patients may require antibiotics before certain dental treatment, with not as many as we did years ago, but there are a few. But so you'd have to ask your cardiologist or if you have an issue like that. Stroke is the same thing. We have studies indicated increased risk of stroke in people with gum infections, and especially it's higher if you have a more severe infection. Oral bacteria also can attach to the fatty plaques in the arteries and can form the brain clots and block that blood to the brain and cause the brain to die, which is what we call the stroke. Again, the same thing as with heart disease. Right now, we're not sure if it's total cause and effect as much as a high link, but more studies have been being done, and we're seeing it looking pretty strong. I also want to talk to you about respiratory problems, because bacteria associated with periodontal disease can travel from the mouth and throat and get into the respiratory system. And what we see a lot, particularly in nursing home patients and the elderly, is they can get aspirating pneumonia. And when they get that, sometimes it's even the bacteria that's on the dentures because nobody's cleaned the dentures. And this is, I almost hate to say this, but I had a dentist friend of mine in Farmington who had a patient from a nursing home, and they found out the patient wasn't feeling well, took her into the dentist, and she had a denture with so much plaque on it, it was stuck to the roof of her mouth, and they had to surgically remove it. I don't want to gross you out, but it is gross, because that's really neglect, and that nursing home should have had better care, and hopefully, the patient's family, they just really didn't know and understand, and we have to make people more aware of that. So we have to kind of look at those things. And if a person has COPD, that chronic obstructive pulmonary disease, they're going to have a weakened immunity system, and they might be more prone to that. So these are things that we have to look for that you wouldn't have thought about, right? I talked about diabetes. Diabetes now, we're having like 9.3% of the population have had diabetes in 2012. It's probably up even more now. And periodontal disease is kind of the sixth complication of diabetes. The people who have diabetes are 3 times more likely to have periodontal disease. And we also know that it's a two-way street with diabetes. The diabetes will not only affect the oral health, but poor oral health will change the glucose levels. So it's a back and forth. This is the strongest link, cause and effect that we have. So every patient I see with diabetes, I have to really talk to them a lot about controlling their diabetes as well as controlling their periodontal disease. So it's a really big thing. And I had a patient recently who told me he just had 4 quadrants of really deep cleanings, and his diabetes numbers, his blood sugar went down 30 points. So, in some cases we have seen that, some cases not as much, but he's also working on his oral hygiene pretty well. So for him, he had a really good result. So diabetes will lower your resistance to any kind of infections, including mouth infections, and will also hurt your ability to control the blood sugar. And this will then hurt the rest of your diabetes control. So all of these things are totally related. Also, what you'll see with more oral infections with those with diabetes, you'll see more gum inflammation, more dry mouth, burning mouth syndrome. If the mouth burns a lot when you eat, some people are like, oh, my mouth burns all the time. What's going on? Well, kind of could be due to the diabetes. And also, we see a lot of oral fungus, and particularly on the tongue and kind of the sides of the mouth, and sometimes the throat, and you don't want to get it there, believe me. So good oral hygiene and routine dental visits are extremely important. And I showed you before the picture of the looks like the desert of the tongue from that dry mouth. So that is another complication, not only of diabetes, but also certain medications that we take, a lack of saliva. And we also will see it worsened by many, many medications, and I'll show you some of those in a minute. Smoking and drinking will also make the mouth drier, and dry mouth is really hard to diagnose. Really easy to diagnose, and hard to treat. It's just really difficult to do that. So we have people use artificial saliva, or we have them use certain types of rinses and sprays to try to help them. They drink a lot of water, and it's particularly hard for people when they've had head and neck radiation. And you can see here the teeth look really, even the gums look really dry, and they're more prone to tooth decay because the bacteria and the food will stick to the teeth more easily, and if they drink acidic like diet soda or something like that besides, they're going to be really prone to decay because nothing can flush it away. It's going to stick right in the mouth. So even diet soda has a lot of acidity to it. People don't know that, but it's true. So, and I mentioned the energy drinks. So you can kind of see the difference in the texture there. This is gross, but this is oral fungus. Actually, the left side is from a CPAP machine where they didn't clean the CPAP machine, but they also had diabetes. So, and on the tongue is another spot you want to brush the tongue, because a lot of that's called the black hairy tongue on the right side with that coating on it. And I'm glad you're not eating right now, so at least you can, when you look at it, you don't get sick. I'm sorry. The effects of medication on oral health. Birth control pills can also cause more inflammation of the gums. Inhalers can dry the mouth. Blood pressure medications can cause gum tissue to be enlarged. Anti-seizure, antipsychotic, and antidepressants, and some of these other drugs will cause dry mouth. Anti-rejection medications can also cause overgrowth of tissue on the gums. And so a lot of these medicines, you want to ask your doctor about side effects if you're seeing something different in your mouth, because they might be able to change your medication to something else. And here's just a little example. There's a little tissue overgrowth. This is nothing. Sometimes that tissue goes all the way down to the edge of the tooth, but the medication makes that person more prone. And it's not everybody either. Just some patients have this reaction to some of the blood pressure medications, mostly is what I've seen, and they're like Dilantin and some of the epilepsy medications and such. I see that the most. And also medications that have syrup in them or have chewable tablets with sugar, you have to be careful, particularly if you have children that take that a lot for tooth decay, because they're constantly putting that in their mouth. And some of these gummy vitamins, you got to watch those because they can harm the teeth as well. And frequent consumption of sugars in foods, beverages, and medications will increase that potential. Rinse the mouth with water. Ask for sugar-free medications if the doctor, if you have lots of cough medicine, mostly has sugar in it, so see if you get something else. Now I'm going to talk a little bit about thyroid disease. Both hyper and hypothyroidism can change some of the functions and the health of the tongue, the teeth, and the gums. And sometimes dental treatment may need modification, particularly when we're using local anesthetics. Sometimes you don't want to use one with what they call epinephrine in it, and you have to be careful because it may complicate some of the heart situation. So you want to, if you have a thyroid condition, you might want to talk to the dentist about it and make sure that they know that really well. So always bring your little medications to the doctors. Those with hypothyroidism, the underactive thyroid, will tend to have it's mostly middle-aged women. They'll have enlargement of the tongue and salivary glands because there's a little swelling in there. They'll usually have poor, not everybody, but many will have poor periodontal health, slower wound healing, increased bleeding. Sometimes the taste is altered, might have more of a metallic or dry mouth taste, the burning mouth again. And sometimes the enamel does not develop well, so they might have funny looking enamel if they had it as a child, that it might not have worked well from poor calcium and absorption and such. Delayed tooth eruption, undersized jaws. Sometimes the bite is open because the jaw hasn't formed all the way. Thick lips, mouth breathers, and they are at risk for low blood sugar and other tooth infections. So that's for the person with hypothyroidism. Those that have an overactive thyroid, they may get that goiter in the neck due to the enlarged thyroid, extraglandular thyroid tissue at the back of the tongue and the throat, so it might be difficult to swallow. It might be also difficult if you're the dental provider and you're trying to work on the person. The tongue's always in the way. That's, the tongue looks very large sometimes. Increased dental decay, burning mouth or dry mouth from the medicines, increased bleeding, more gum disease, rapid tooth growth in children, and possibly osteoporosis in the jaw. So those are some things we may see from that disease. Now this is an interesting one. We're finding that probably now more and more people are being diagnosed with the celiac disease, or they have problems with eating gluten products because their small intestine cannot tolerate it. It's an autoimmune disease and it damages that area. And we're now seeing, and this is a fairly new study, that children who have that at a young age while the teeth are being formed are more likely to have dental defects in the teeth. Now you can see there the notching in the teeth and the brown coloration. And we always have said, well, it's probably due to the mother had a high fever when she was pregnant and it affected the teeth. But we might now have to say, have you been checked for celiac disease? So we might have a new thing to ask our patients if we see this, particularly in the permanent teeth, to find out what happened to that child down the road. And I was telling them at a recent lecture I did in Columbia, I had someone in the audience who raised her hand and said, my child's teeth look just like that, and she was just diagnosed with gluten allergies. So it was kind of interesting. And they think it's from poor vitamin D and calcium absorption because they can't absorb it as well with the autoimmune problem that they have. On adults, sometimes you'll see more canker sores. You might see a smooth, painful tongue that burns. You might see cracks around the lips like you see there on the bottom left. You might see what we call lichen planus. It looks like little lacy stuff on the sides of the cheeks and on the floor of the mouth. Or could be cancer down the road. So these are some things that if you have sores that keep coming back and they don't get better and you have tummy issues, kind of put your head together and think, maybe we should look into this and see if something else is going on, okay? Now, for many, many years, we, as dental professionals, we would pre-medicate patients if they'd had any kind of hip replacement or a knee replacement or any kind of joint replacement. And the reason is, in some cases, very rare cases, but sometimes the oral bacteria have been suspected as a contributing factor to failed implant. And so because there's a secondary inflammatory response. Nowadays, many of the doctors will still pre-medicate someone for a short time after the implant has been done, but they probably don't need it for the rest of their lives unless the doctor has a reason for it. So we've kind of been going back and forth on this as dental professionals, because for years you got to pre-medicate, you can't come in, we can't touch you. And then they said, now you don't need it anymore. And then so we're like going back and forth. So, but if you do have that, we do know that if you're going to have a joint replacement, have your teeth checked first before the surgery, and make sure you're practicing good oral hygiene, because that's, because that you can see you don't want to end up with that hip, that side hip here, like that person has in that lovely picture. Kidney disease. Preliminary studies suggest a connection between gum infections and kidney disease, and that's due to the weakened immune system, more susceptibility to infections, inflammation, my favorite word, calcium imbalance, and diabetes association with kidney disease. And kidney transplant patients do have to have generally their dental treatment done before anybody will do the transplant. This is for any transplant patient, but and they usually will be on antibiotics, cephalosporin or something for a long period, forever, when they come in to get their dental work done. And so that's important to know if you have that problem or if anyone in your family does. But again, it would be really nice if the dental treatment were funded all the time, because it's probably more cost effective to do the prevention than it is to have a kidney dialysis down the road. So I think that we're going to be seeing some changes in that, maybe medically down the road as more of this comes in here. And it also shows that kidney disease, for those on dialysis, they are more likely, people who have that are more likely to have periodontal disease and other health problems than the general population, because again, that immune system is working overtime. I don't know if you've heard of Sjogren's disease. It's kind of an interesting disease. It's autoimmune also, and the person's white blood cells attack their moisture-producing glands. So it'd be like the salivary glands and the glands in the eye, so they get dry eyes, really bad dry eyes, and really bad dry mouth. And with that, again, there's that risk of increased dental decay with the dry mouth, and so again, would also require more dental visits and be accompanied by eating disorders. Sometimes we see that with it, which leads me to bulimia. We have a lot of people, particularly young women, who are binge eaters. They then purge and try to get rid of all their stuff by either vomiting or all of the other ways of getting rid of their food. And again, that's going to attack that tooth enamel because it's acidic. You'll also see a swollen mouth, throat, and salivary glands, and also they're malnourished, so things don't look too good from that. And there'll be bad breath, there'll be dry mouth, and lots of problems. The teeth will change in shape and color. They'll start looking a lot more squarish jaw. And on the backs of the teeth, I don't know if you can see this on the see in here, this is the back side of the teeth, the tongue sides of the teeth. They're all worn in there. I had a patient, I brought it up with her, and she didn't come back again. She didn't like to be discovered. And but I could see that her teeth were really in bad shape, and I knew that her health had to be in bad shape, and she was skinny, she was so thin. So I always felt badly, but you'll see a little of that chipping and things like that. Very serious, because you can die. I had a dental assistant that I worked with in California for a while, and took her a long time to get back to normal because she had that. Arthritis. We have now rheumatoid arthritis patients will suffer from gum disease 4 times more than most other patients, and they also have more serious tooth decay. And part of it is you can't hold the toothbrush and you can't work with your hands and your joints very well. It's very hard to perform good oral hygiene. So we recommend electric toothbrushes and interdental cleaners and any kind of holders that they can use to floss with. Something that's big that can be gripped would be a good way for them to work on their own mouths. And also, otherwise, they might have to come into the dentist more often for more frequent cleanings. And there is a very strong link between rheumatoid arthritis and periodontal disease. And we also now think that some of the pathogens from periodontal disease may support the infection or may support the role in getting rheumatoid arthritis. So this is still being studied. Not all this stuff is, for sure, but it's really, and my one dentist I work with did his master's on the arthritis connection to periodontal disease. This was like 30 years ago, so his brain was thinking way ahead. Because we have that poorly regulated immune system, this might also have a lot to do with it as well. Can affect your salivary glands. Again, you'd have more inflammation and dryness in the mouth. And also the temporal mandibular joint right in here, you know, you can get a little more arthritis there. You got the cracking of the jaws, and the jaw gets tender. So what we do is we try to make shorter dental appointments, or whenever I'm working on someone, I'm saying, okay, anytime I take my hands out of your mouth, go like this. You know, make sure that your jaw gets a rest. And I tell them every time I do that to make sure they do that. So also, they have a lot of medications they take for arthritis that may upset their stomach. They may vomit more, and then more acid in the mouth. It'll hurt the teeth. Steroids can lead to more infections because they're immunosuppressed if they're on arthritis medication. And methotrexate, which often is given, can also cause a lot of mouth sores and irritation. We also have some suggestion between a link between osteoporosis and bone loss in the jaw around the teeth, and the theory that it could be triggered by periodontal disease that could weaken the bone in other parts of the body. Hasn't been proven yet, but some studies are linking that. And particularly women are 3 times more likely to experience tooth loss than those who don't have the disease with osteoporosis. And it can hurt your denture fit, can cause oral surgery outcomes to not be as good, and you have to be very careful of the injectable bisphosphonates. If you're getting a tooth out, you're more in danger of infection. So you have to be very careful to tell an oral surgeon or any dentist that you're on that, if you women are on that, or sometimes men would be on it. I have one man was on it. And you also need dental x-rays to have your bones evaluated. Pregnant women are going to have higher hormonal levels, as I mentioned before. They're going to make them more at risk to having inflamed gums, and it can lead to periodontal disease. So treatment during pregnancy is important. Years ago, dentists wouldn't treat till the 2nd trimester. Now we know that was a mistake. Treat as soon as you can when you're pregnant. And we had some studies that show that women who had more severe gum disease would have more preterm, low birth weight infants than those of with normal birth weight babies who didn't have periodontal disease, and that bacterial infections may speed the production of labor-inducing fluids that will result in that early birth. So we have to get more research on this, and again, treat the mother early. On Alzheimer's disease, any kind of inflammation in the early or middle stage of life can increase someone's chance of getting Alzheimer's disease. And we're also now thinking that if you lose your teeth before 35 years of age, you might be a risk factor for Alzheimer's disease, which is very interesting, I think. And so we're trying to study now the link between oral health and brain function over time. We do know that the loss of memory will lead to unintentional oral neglect, poor oral hygiene, not going to the dentist. You lose your contact with the dentist. Your family is having a hard time taking care of you. The dentist is the last person they think about. More mouth sores, all those types of things. I'm just going to quick hit smoking. If a smoker has 3 times more risk of having periodontal disease than someone who does not smoke. And all these other things go with it: inflammation, oral cancer, periodontal disease, staining, poor wound healing. All of these things are impacted by smoking. If you smoke, try not to. It's really tough. And we're talking smokeless tobacco as well, any kind of, and I'm not crazy. I'm not a fan of electronic cigarettes either. I know some people like them because they think people are quit. I think people are smoking them more than you think, and so I have a problem with them. So we don't know yet much about them yet, but I don't like to try something I don't know anything about. I talked about the soda thing. One of the things about the soda is every time you take a sip of soda, you get a 20-minute acid attack on the teeth, and that can cause tooth erosion and decay. And the teeth become, remember I showed you the woman who was doing the bulimia, how the teeth look translucent? That can happen with soda drinking too. The teeth, you lose the strong enamel coating on the teeth. So if you drink soda, drink it in moderation, not for extended periods of time. Don't do the put it down, sip all day, or you're going to be very prone to problems, because soda is a big thing in our society today. Everybody loves soda. I like soda, but we can't do it. And if you're going to drink something else, drink fluoridated water from the tap, not from the bottled water, because it doesn't necessarily have the fluoride in it in bottled water, and get that regular dental checkup. So bottom line is most dental diseases are preventable, and good oral hygiene can help prevent the problems in the dental visits. Make sure you have a thorough dental visit. You'd want a good medical history taken of you. Antibiotics might be needed for you depending upon your health history. Cancer screening, they should check the teeth and bite, the gums, do that little probing I showed you. The denture and partial check, if you have those. Oral hygiene and home instructions are very important. Make sure they show you how to do it, because most of the time what you've learned is something you just did on your own, and maybe it's not good enough. I have found almost every patient, almost every one I've seen, is not doing it correctly. So you have to be shown. The tooth cleaning, fluoride sealants for children, fluoride for adults too, by the way, if needed. Fillings, crowns, implants, cosmetic dentistry, and referral to specialists when needed. So you want to have a really good exam. Teeth cleanings are very important. Look at the difference here just from getting the teeth clean. This is what I do all day. And also prevention. Obviously, prevention is going to help you save money, time, pain, and you're going to help keep your teeth a lifetime. When you're brushing, tilt the brush. This is more of a 90-degree. I'd tilt it a little more myself. Somebody I didn't like. It's the only picture I could find though. For more of a 45-degree angle along the gum line. Only brush those 2 teeth at a time, not the whole jaw, because you won't get the plaque off. Inside, outside, tops of the teeth. Short back and forth or circular strokes. When the gum line is important. That flossing is extremely important to get under the gum all the way. Curve it up under the gum. Follow that tooth contour. It's not up and down. It's curvy. And go, even if it bleeds along under the gum, do it anyway, because we got to get rid of that inflammation. Bleeding means there's inflammation, means you got to work harder on those spots. Does that make sense? Okay. And clean your tongue, because it needs to be clean. We saw that black hairy tongue. We don't want one of those. Denture care is very important as well. Clean the dentures and brush them daily. Place them overnight in the bath and use a denture cleaning tablet. Like Efferdent, Polydent, different ones that fizz, and they keep them pretty clean. The same if you wear a night guard or other orthodontic appliances. Soft tissues, brush the tongue again, wipe the ridges and cheeks of the mouth, have a yearly dental exam. You may need relining, it might not fit anymore, and check for mouth sores and cancer. So your oral health is also, your nutrition is also important for good oral health. So you want to eat foods from the 5 food groups, and make sure that you're eating a lot of fruits and vegetables and not so much of the sweet and carbs like we all like. Bottom line is poor oral health means pain and infection, eating disabilities, problem chewing, swallowing, poor nutrition, can't talk well, can't socialize. It contributes to your chronic health problems. It's an economic burden. It may also, if you don't have teeth, it's hard to find jobs because you might not be hired. Poor quality of life. So if you're not healthy without good oral health, and that's what our former Surgeon General Everett Koop said, and I tend to agree with him. So I want to see if you have any questions. We have time for a couple questions. Anything you want to know about? Did we get it all? If not, yes. How many
times a day should you brush your teeth?
Okay, the best time to brush is right after eating, whenever you can. And I would say morning and evening. You definitely want to brush your teeth before you go to bed. You don't want to go to bed with a dirty mouth, and because that bacteria will just stay in there, it'll start sticking to the teeth more. If you can brush more, better. That's even better. But you know, if I were on the desert island, I'd probably rather be with my floss and maybe my interdental brushes. Not that the toothbrush isn't good, but sometimes you can self-cleanse those a little more easily than you can in between the teeth, particularly if you have spaces in between the teeth because you've had a little bit of bone loss. You know, and sometimes you get a little of that when you get an in-between filling or a crown in between the teeth. That's going to hold more plaque because it's rough surface, so that means you have to clean that area a little harder, a little longer, because it's going to catch there more easily. Does that make sense? Okay. Anything else? Yes, ma'am. Mm-hmm. Well, I'm not a big fan of peroxide because they had some, years ago, they had some studies that if you use it too often, it actually could cause some cancer in mice. Occasional use of peroxide is not going to hurt you, but I wouldn't do it every day. And it can do some whitening, but I would just, you know, for whitening, I'm kind of a fan of going to the dentist and have them checking your teeth out first, because if you have like a lot of crowns or you have a lot of root recession or gum recession and the roots are longer, sometimes with the whitening you're going to get more sensitivity after it, and you're not going to like the way it feels. So I would have those evaluated first. Or what you could do is I would go maybe get like Rembrandt strips, like at Walgreens or someplace, and just try something not so strong and just do a little bit and just kind of test it. You usually have to have a little tray, and you put it in the tray for 20 minutes in and then 20 minutes out, and you kind of have to spend a couple hours of your day doing it. But do something like that, and then, you know, if it's a little sensitive, it won't be sensitive for a long time. So I'm more into using those kind of products, but kind of ask your dentist first, because you don't want to do something that'll make you more uncomfortable. Does that make sense? Mm-hmm. Anything else? Yes, ma'am. Mm-hmm. Yeah, you know, I don't particularly have a problem with baking soda, but baking soda does not have, is it just plain baking soda? Yeah, it does not have fluoride. I want something with fluoride. Tell them to go back and forth. Use some fluoride sometime, because you really want that fluoride on the teeth, especially as we age and our mouths will get drier naturally from natural aging, particularly when we get on more medications. We're going to all get drier mouths. Okay. Yeah, I'm not a fan of the peroxide. I'm just really not a fan, just from some of the research out there. But, you know, yeah, those are good. Yeah, those are good. Listerine would be good. Yeah, that would be good. Now, Listerine and some of those products are very good. Now, if you have a problem with alcohol and you can't have alcohol, or if it burns, get the kind without the alcohol in it. Some of it is does not have alcohol. I would go to something that, because if someone has a problem with alcohol abuse, that, you know, some of those products can bring back the abuse, and we don't want that. I had a little training in that, and I just said, no, none of that stuff, because, yes. I would go after, you know, because most of the time you want to try to get as much as you can off first. People always say, do you floss first? You know, it really doesn't matter, but I personally like to brush first, then I floss, and then I would use the mouth rinse. That's what I would do, and I really like electric brushes. I personally like the Sonicares. I like the Braun. The Oral-B Bronze are very good. I do like the more expensive ones, because they will last longer, and they're more expensive first, but they're a good investment in your health. And I've seen really good. I mean, I don't have to, when I work on patients now, patients I've seen for years, it doesn't take me as long to work on them anymore, because they're using, so many of them are using electric brushes, because, like, man, I'm proud of you. You're doing a great job, you know. And I kind of like the water picks too. They're not going to get sticky film off, but they'll get the hunks of food out, so it'll be easier to clean, you know. So those aren't bad. They're they call them water flossers today. So yes, ma'am.
I just have another quick question. I realize 2 minutes is a lot longer than I thought it was before my life
It is a long time. Yeah, especially when you're doing, like, okay, we're doing so many seconds on this side, and now we're going to this side, like, whoa. But it does take a while to really get that plaque off, to break through that. Remember, and that's why, because you're really breaking through those layers of bacteria. Everybody thinks they're just getting food hunks off the teeth, but you're really getting the slimy film off. And some people it'll hold on their teeth more based on their saliva, based on what they eat, based on the teeth formation, you know, the way they're formed and the bite, things like that. Or fillings, you know, they'll stick to fillings more. So, anything else? Well, it's a pleasure being with you all today, and I hope you learned a little something about oral health and how it's connected to the rest of your health. Thank you. Mm-hmm.